It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hey, Dr. Urse, we're back. Sorry for my cold. I picked it up on a cruise. Don't know what I got. It was an extra bonus part of the cruise.
Well, as long as you don't give it to me, I'm happy to be here with you, Terry.
I didn't pay for it. It's just part of the package I got. We're going to talk today about PRP, but before we do, let's thank our sponsors now.
Well, thanks. That's a great idea, and we appreciate what they do. So, Ted's Salad Dressing. If you look at tedsaladressing.com, Ted's is a Greek dressing. It's a gluten-free, dairy-free, sugar-free. It's a marinade and a dressing, so you can marinate your meats with it. It's also on salads, obviously. And we want to thank Stifel GWR Group, financial consultants, for all your financial needs that include retirement planning or investing for profit.
Correct. So I know you're a baseball fan.
And baseball player.
And a baseball player. You're still playing actively at your age.
2 leagues. My wife's chagrin, but I am.
So we're going to talk about something called PRP injections, and you got to explain to folks, because we've done this a couple times on different topics about PRP. What is a PRP injection, and do athletes get these? That's kind of what I want to ask real quick. So explain to folks what a PRP injection is for and what it is.
Well, I'm going to tell them the title first.
Oh, please do.
Because that is the beginning. So normally when you meet somebody, you don't say, here's a picture of my kids. You go, hey, Bob, I haven't seen you since high school. And you talk a little bit before you show them the picture. So before we talk about PRP, let's talk about the title, which is, what can PRP do to help knee arthritis?
Really, that's the title?
Well, it's what it's about. We're going to talk about how the PRP works. So we're going to talk about platelet-rich plasma, PRP, mercifully abbreviated. And when we talk about things that disable people, knee arthritis is the number one cause of disability, at least in the United States, and I would guess worldwide.
Knee arthritis.
Knee arthritis. So there's a lot of things that kill people, cancer, heart disease, strokes, whatever, but disabling means it hurts. I can't do the things I want to do. I have pain. My knees keep me from doing what I want. The knee is the most commonly arthritic treated joint in our body.
Right.
It's the most common things a family doctor will see in their office, a chiropractor, even though he sees backs and spine problems, will also see knee problems. Orthopedics is probably our number one problem we address at all ages. And sometimes there's certainly not arthritis issues in teenagers, but injuries to the ACL ligament that allow the knee to bang around and scuff the cartilage, those lead to arthritis or soft cartilage conditions at younger ages. So we are here to get our patients to age 90 with their body parts.
Just quickly explain. Again, I think it's fair because I can't remember. What exactly is arthritis? If you could just sum that up in 30 seconds or less.
Well, arthritis is where the cartilage between the bones, our joints have smooth gliding surfaces.
Yeah.
Look at the end of a chicken bone. It has a white gristle or cartilage. Those smooth surfaces let our knees and hips and shoulders move smoothly back and forth. When cartilage wears down from injury, from arthritis, from gout, from rheumatoid arthritis, whatever trauma or wear and tear occurs over time, then the cartilage gets scuffy marks on it or wear patterns.
Yeah.
And then the cushion between the bone diminishes, the joint space narrows. So we would ask, the first thing we would tell people is get a weight-bearing or standing x-ray of your knees and see how the space is between the bones. When you lose the cushion, which is the arthritis developing, the cartilage wears down and the bone rubs on bone. And you've heard people say, I have bone on bone in my knee or my hip or my shoulder. And that's because arthritis is a condition where the cartilage is worn down from whatever reason. And it doesn't have to be just wear and tear osteoarthritis. It can be rheumatoid arthritis. It can be gout. It can be other forms of trauma to the knee. And those can make one knee hurt and the other not hurt. So start with an x-ray, find out if you have arthritis.
Right.
How bad is it, mild, moderate, or severe? And what is it doing to your lifestyle?
So if I have arthritis in my knee, and I probably do, to be honest with you, my options are a knee replacement, which is the grand solution, correct? But then there's other things you can do along the journey to lengthen that period of time, or maybe to solve the problem in another way.
Right. What I tell my patients is really simple. I say, here's your films, no matter how bad they look. We can control your problem, or we can cure your problem. If you want to cure it, then let's replace the joint, solve the problem by getting a new car. A new car solves that bad engine that you've been trying to fix.
Yeah.
You look at cars from Cuba, they're still running from the 50s. So there's ways to control it or keep it running, right? So the way we control pain or a knee arthritis problem is 3 or 4-fold. We can do injections. We're going to talk about cortisone, gel, and PRP and stem cells, which are your own biology, the last two.
Right.
We're going to talk about therapy, which helps knees.
Okay.
We're going to talk about knee braces and shoe inserts that balance the knee, or maybe your knee's a little bow-legged or knock-kneed, and aligning the leg with an insert in your shoe will help the force across your knee. We'll talk a little bit about weight reduction and some of the activity modifications. If running on hard pavement hurts your knee, maybe you should get a stationary bike or swim or Stairmaster. You may want to decrease impact. But today we want to talk about controlling your knee arthritis with PRP. And the reason we bring up PRP is it will, in my opinion, it'll be the treatment of choice and the number one treatment for knee arthritis in the future. And that's because there's abundant literature about it. It's a newer technology in the last 10 or so years in the United States, but longer worldwide. The options of cortisone, which everybody gets a cortisone shot. I tell people cortisone shots are like a wedding bell blue injection. You have a wedding bell and you want to get to that church and walk your kid down the aisle because your knee is bad. Well, a cortisone shot is fast acting, but it's not long lasting. So it's going to get the athlete on the field to play that game. He's going to get mom down the aisle with her daughter walking in the church where she doesn't limp. But it's not going to last real long, and it's not the greatest
How long
thing.
does it last?
Cortisone can last usually weeks to months. And, again, I'd say the average cortisone shot is probably 2 to 3 months, and maybe less if you've had more of them. And they're not really good for the joint in the long run. There are some cartilage breakdown issues with cortisone in the long run. Higher dose cortisone can really hurt a hip. So we use lower doses when we do a hip injection. But the other option of injecting a painful joint is these gel or viscose supplement injections. So literally, if you've seen The Wizard of Oz, the Tin Man gets a little oil in there. A lubricant gel can be put in the knee. Unfortunately, it only works on 60% of people. So the evidence for it is getting weaker. It just doesn't work well in studies. And in some larger insurance carriers like Blue Cross and Blue Shield, they don't even pay for gel injections in knees anymore. And the FDA and or at least Medicare, what's called Center for Medical Services in America, doesn't cover the gel injections for any other joint but the knee. So you can't have we talked about arthritic hips and shoulders, ankles. Gel is not approved in the other joints, which is kind of silly, really, because it'd be like 3 hinges on a door and saying you can only spray the middle hinge, not the other ones with WD-40, right? So our insurance policies govern a little of what we do, because if the insurance is paying, well then, hey, that's something you don't have to pay. PRP, on the other hand, the patient usually has to pay for that, but it's actually priced less than a gel you would have to go buy if your insurance didn't pay for it. So PRP, which is platelet-rich plasma, comes from a simple draw of blood from your arm.
So they get it from you.
Yeah, it's your blood. So there's no downside to it. You drink a lot of water that day so we can get some blood.
Yeah.
And the amount of blood you take is really important. If you take a small amount of blood, you get a small amount of platelets, and you don't get a very good result. Some of the literature has been up and down on how much PRP helps, and that's where someone reading the articles needs to see how much blood was taken and what was the platelet count, and you want a high platelet count. And the only way to get that is to take a lot of blood. We take 120 cc's of blood.
What is that? Just curious.
It's about a third of a pint. If you donate a pint of motor oil at the Red Cross donating blood.
Seems like a lot, yeah.
Yeah, it'd be a third of that.
Okay.
But that then is spun in what's called a centrifuge, a spinner device, that is concentrated, and we take out things that aren't good for your knee, like red blood cells, some of the other cell lines. There's some argument of whether white cells help or hurt the knee itself. But either way, we concentrate the platelets to get a 10 to 12 times normal serum level of the platelets. By getting a high concentration of platelets, injecting that in your knee, we use a thing called an ultrasound, and we put the needle into the joint so we know it's going into your knee.
Right.
That helps us get it accurately where it needs to go. Then that simple process takes about a half an hour in the office. You walk out. You don't need someone to drive you. You don't need medicines for it. It's like a cortisone shot, but it's much better because it'll last 1 or 2 years.
So cortisone shots, you feel it instantly, right?
Well, you will feel some of the Novocaine with the cortisone. Cortisone may take 3 to 7 days to work.
Yeah.
But it usually helps if your doctor adds some numbing medicine with it, like the dentist does.
And what about PRP? When do you feel the results of
Most
that?
people feel it pretty quickly. There's 1,100 what are called growth and anti-inflammatory factors in platelets. Those are in your blood, and all you're doing is saying, I want this in my knee so I can have less discomfort. The good thing is it's going to last a long time.
How long?
I just said 1 to 2 years.
1
and
to 2
maybe
years.
longer. I've got my brother came down from Michigan over February of 23, so he still says his pain is a 1 out of 10 on both his knees.
Really?
He's playing basketball in his 60s, and he does a sky hook. He's probably not that famous for it. But I will tell you that they may need to be repeated. Platelets.
Can you do that?
Oh, sure. PRP does not grow cartilage. We're not making your x-rays look normal. There is certainly a stronger and better benefit to what are called bone marrow aspirates. And that's where we get our stem cells from the bone marrow. That's a different conversation. We're not talking about those today. But the PRP is, you asked about athletes. Would an athlete get it? Absolutely. In fact, the sports and Hollywood and music world have been doing these. These are basically called orthobiologics, meaning they're your biology, your blood, being used for orthopedic problems. And the plastics and dental industry has used these for 30 years. There's PRP being used for hair growth, dermabrasion.
I could use a hair growth one.
If you've seen the Kim Kardashian dermabrasion, the plastic surgeons have used PRP for years on facial and plastic surgery.
Do they just
dental
put-
application? Don't know how. Don't do that.
So
All
I
I can tell you is I know how to put it anywhere you need it. PRP is also used for other things like a ligament sprain, what's called kneecap tendonitis. They call it jumper's knee.
Jumper's knee.
There's less evidence for something. It's a great option for tennis elbow. That's not today's discussion. But platelets are your own biology, and they're a really simple source of benefit to people. And that's why I tell people someday there's 1,800 articles on PRP out there now. And the mainstream
And you've been
medicine,
doing this for how long?
about 10 years.
Okay.
So and I ask my patients, we give them outcome scores. I go, well, Terry, how did this work for your knee? It's like, oh, my knee feels great. I'm like, wow, I'm going to keep doing those. Like
Right.
if you told me every one of these is not really working, it doesn't take long for a healthcare provider to go, gee, I don't think this is doing very well. I'm not a fan, and nor is the FDA in the United States, of some of the amniotic sources where they take the placenta of a C-section baby and they
Sure.
get the what are called the amniotic cells, and they put them in a syringe and package them. Those cells have some anti-inflammatory factors, but they're dead cells. They've been taken to a factory, packaged, put in a syringe, put in some salesman's trunk, and then taken to some guy's
Salesman's
office.
trunk.
Well, it's true. And if you look under a microscope, the cells are dead. I mean, these are the one thing the FDA said is you can use what are called biologics, which is your biology, as long as you take them, use them immediately. You can't store them in a refrigerator. You
Right.
can't grow them on a petri dish and get more of them. You can't what's called agitate them excessively with some of the fat sources. There's other ways to get some of the biologic cells. So today, this is just a simple talk about drawing blood, getting the right amount. And I think you should ask your doctor or provider, like, how much blood are you going to take and what do you expect to get in the way of a cell count for my knee? Because if you get a crappy blood draw, you get kind of a crappy result. And that's why some of the literature has been so up and down. And when the reviewers who review articles say, well, that PRP may not work for arthritis, that's the wrong thing to say. What they should do is say, we looked at the ingredients in your chili, and guess what? You had a lot of things that make it taste bad, and that's why it's no good. Well, they should look at the materials and the methods of how the PRPs harvested, how many cells were gotten, and then say, okay, did we wait long enough for it to work? Is there a good material and study method to make a statement as a journal? And if the journal does their due diligence, they review the article properly before they give it to the New England Journal, and then every news media publishes their fake news, if you want to call it that.
So if I'm walking into your office, Terry walks in with hey, doc, my knee's kind of been hurting me. You're going to do what first? You're going to take x-rays?
I'm going to examine your knee first.
Okay.
I'm going to see where it hurts.
Yeah.
I'm going to take an x-ray, sure. And if you're a young person, you're not going to need a new knee.
Like me, I'm young.
You might need a MRI or therapy. You might just have sprained your knee and need a brace.
Yeah.
You might just need a injection, a cortisone shot when you twist your knee, may quiet the knee down. It's fast acting.
So you find out I have some arthritis. You're going to either say, I can give you a short-term solution, which is cortisone, right? You don't do the gel, or you do.
I don't do the gel myself.
Okay.
I just, first of all, it doesn't work on 40% of the people, and it costs. If you go on GoodRx, which is one of our bargain prescription cards, you can use,
I use them all the time.
You're going to pay $1,400 for a gel injection to take to the doctor if your insurance doesn't cover it. If you have Blue Cross, the largest carrier in Ohio, so I tell people, I wouldn't do that. It doesn't work on 4 out of 10 people. It's not very good results. And it doesn't last very long. Platelets from your own blood last 4 times longer. They can even longer than 2 years in some people. It can be repeated, but there's some upfront expense. And I tell people, if you're going to spend $800 on your dog's nails, spend a little bit more on your knee you're going to walk on the rest of your life.
So you're not going to do this to me on my very first visit?
No. I'm going to say, these are your choices. You can control your problem, or you can cure your problem. If it's really bad arthritis and you can't walk and you're going to jump off a cliff, I'd say, let's talk about a knee replacement.
Okay.
I mean, if you're ready for that, I'll talk about robotics and knee replacements and all that. If you want to go down the other path and say, tell me about safe alternatives like injections, therapy, braces, shoe inserts, then I'll talk to you about that.
Okay. I'm not sure how many other people in the area do these kind of things. You were kind of leading the way on this for a while, because we've been talking about PRP and STEM for years now on different podcasts. And is it catching on?
I think it is catching on. I'm just going to do my straw poll because I'm on a state medical board also.
Yeah.
Where I'm trying to get them to even do a lecture about this, but I think modern medicine is a little behind the times on newer technology.
What's it like in Europe?
I think it's much more common overseas, certainly Asia. I'd say 10% of healthcare providers in a 60-mile radius of where I live would utilize PRP, maybe. I'm just guessing because most people I know don't use it. A few of my partners do. We've got a 24-person group, so a few use them, and I think at some point we could bring some of them on and say, hey, are you seeing some good results with this or not? I mean, it's covered by some of the insurance providers. We have a large Air Force base in Dayton called Wright-Patt Air Force Base, and some of the insurers for the military cover the PRP for knee arthritis, as they pay for it, and for tennis elbow. So there are some insurances eventually will say, gosh, it's cheaper than a surgery.
Right.
Why wouldn't we cover it?
Yeah.
I think they're going to cover it someday because it's cheaper for them, not because it's better for you.
Right.
I mean, I hate to say it about insurances, but let's face it, I think we all know where a lot of their tendencies are toward.
Oh, sure. Lower cost is where their tendencies are toward.
Well, and it's non-invasive. I mean, people go in for a blood draw. It's simply like if you've gone in and getting and gotten a cholesterol or a electrolyte test or a kidney function or liver function blood draw it's all it is.
Now, my father-in-law got one done. He got done probably 4 or 5 years ago from you. And his shoulder was killing him. And
well, shoulders are fast in a benefit because you don't walk on them. So that's good to know. I was going to say everybody's probably had their blood drawn, though, at a lab or hospital where they just check your potassium. That's all this is a simple blood draw. I just tell people drink a lot of water so we can find your veins and we can get
But
the
then
blood
you inject it into...
Well, we put it in your knee using an ultrasound, and that gives us an accurate placement. Now, there's other ways you can use what's called a fluoroscopy unit, which is radiation. I don't like using it because I radiate myself and my patient. But as long as you get it in, like always on the hip, we use ultrasound for the shoulder to get it in the joint accurately. You want to put it in the right place, especially if you've taken the time to get it, spin it, and then charge the patient an extra nickel, right?
All right, so this has been not the 7-minute drill. I think we're about at 20 minutes on this one, but we apologize for that. Is there anything we haven't talked about on PRP we should have talked about?
I don't think so. The topic, I have things on my website, drjohnurse.com, that talk about PRP in more detail. It talks about some of the benefits. There are some blog and review articles that talk about the amount that you need to get a good draw, which I think a greater amount of blood gives you a better outcome. And the last thing I'll say, one of our famous sports medicine doctors from Alabama, I won't drop names, he has done some studies showing that the PRP in the first year has equal benefits to the patient in pain and function control as a stem cell injection, which is from the bone marrow, which is a much more long-lasting injection. But the PRP is a really good option for a short-term fix for your knee arthritis.
All right. Well, hey, folks, this has been the Bone and Joint Playbook 7-Minute Drill with Dr. John Urse. I'm Terry O'Brien, your producer, and we want to thank you for joining us, especially our friends over there in Europe. We appreciate your time and
Oceania and Africa
and
Asia.
That's right. We're very popular in remote places of the world.
Well, again, thanks to Tri-Level Recording for doing a great job on these podcasts.
Well, you're welcome. We'll see you all again real soon. Thank you for joining us. Bye.